I was very, very surprised that the doctor, the head of surgery, wanted to speak to me. I had a meeting set up with Jeff, and we met in a conference room, and the doctor was more or less very, very sympathetic to me, which I thought was like the last thing I thought a doctor would ever, because the doctor is always right. At the meeting, I did learn that on the CAT scan, there was mass on the CAT scan, and that I was to have a pelvic ultrasound. Nobody came and informed me of that there was anything suspicious on the CAT scan, and I was discharged from the hospital not knowing anything. They more or less admitted that there was a mistake, and as far as them coming right out and saying that there were two different discharge papers. The discharge paper, which was the one that was the final one that was signed out when I was discharged from the hospital, was the one that meant that the mass was more serious than the one that another doctor had said. There was a contradiction as far as one saying it was more serious than the other one, but the one that was finalized, that was signed off when I was discharged from the hospital, was the one that said that it was more serious of a problem. So evidently nobody read that discharge paper to inform me or anybody that there was a more serious problem than thought of. They did talk about how things are going to be changed as far as the protocol. Doctors do have a lot of stress, that they were breaking it up between the residents and the emergency doctors. We're going to have different people to go to as far as discharging and things like that. And to also that they, it's something that they don't want to keep continuing. They want to be like a role model for other hospitals. I felt very, very good after leaving that meeting. I felt as though they understood how I felt, and I did want to say that the doctor was very, very kind and made me feel at ease that I did have a reason to be upset. I felt as though that, I'm a meek, mild person. I felt as though maybe I might be a little role model for other patients so that this wouldn't happen to them for what I went through. I don't think I could have gone without my lawyer because, again, as I said, he just was for me, rooting for me. He was my cheerleader. He just made me feel that I had a purpose and that he was standing behind me, helping me out, just being my little angel over my shoulder.
Can I get a copy of this?
And I know people, whatever, and I just knew he was the guy, and I felt so right away that I could talk to him like the regular person would be intimidated by a lawyer. Most people, you know what I mean? They think, ooh, lawyer, or, a big head surgeon. That gentleman, that white gentleman, doctor that I spoke to, he made me feel so at ease. And I am cancer-free right now, and I'm under very, very good care of my surgeon and my oncologist. I go every 6 months, and they do the C125. It's a little nerve-wracking, but so far it's in the low numbers where it should be. I'm doing very, very well now. I just signed up for a pottery class, something I've always wanted to do. I'm since retired. Looking forward to the spring where I can try to do some little bit of gardening. And then also in July, my father was from Ireland, and my brother and myself are going to a wedding in July, and for a wedding, and I haven't been there since when I had been diagnosed with breast cancer in 2006, so I'm looking forward very much to it. I have many, many cousins and aunts and uncles in Ireland.